So basically, once the bandage has been removed and you want to do some home physiotherapy, we're going to talk about that right now. However, what happens if the bandage comes off in the first 24 hours or less and the dog is stable and you're comfortable with leaving the bandage off, and some pets do just fine without the bandage? Then you can apply cold compresses to the area. So imagine a bag of ice, you place that on the area and you place the ice on there for 5 minutes on, and then you can apply, and then leave it for 5 minutes off, and then reapply the ice again for 5 minutes on and off, like you do for any sort of severe sprain or strain of a muscle. Do it 3 times, 5 minutes on, 5 minutes off, repeating it, and you can do that 2 or even 3 times a day. That's for the first 24 hours. However, after that, once the bandage has been removed, and once you're, or after the first 24 hours, you can use warm compresses to try and get blood flow into the area. Some people can alter, or are more comfortable altering cold with warm, so 5 minutes of cold, 5 minutes of warm. And sometimes the dogs tolerate that very well. But again, whatever you do, either warm only or warm and cold, you do it for 5 minutes on, 5 minutes off, a total of 3 times, twice a day. Now for physiotherapy at home in the first few weeks, you basically need to move each joint independently of each other if you can. Some dogs take it better than others, so you should have some help from somebody at the same time just to hold the head, so the dog gets used to what you're doing and is content and comfortable with what is going on. So typically what I get in order to do is put their hand under the knee, and basically you can move the hock, which is the ankle, in isolation, and you do that as much as the dog will tolerate until you feel a little bit of gentle tension about that angle. And all we're doing is just letting the dog know that not every joint's going to hurt. Of course, the surgery site is going to be uncomfortable for them, but it's not, we are sending the signal that not every joint's going to be a discomfort to them. About 10 to 15 times you'll move that. And then typically, supporting the knee, you want to move the hip. And if we can move the hip in the forward and backward direction, and the abduction, adduction direction, or in and out, that's great. About 10 times of this motion, again, to the point where the dog feels a little bit of tension or discomfort, or forward and backward, keeping the knee in the same sort of angle, 15 times. For the sake of brevity, we won't keep doing that. Once the dog's tolerating that well, and that's usually less than a day, you can usually try to integrate 2 motions at once. So in other words, we're removing the hock, we can ever so slightly move the knee at the same time. So I'm going to basically move both at the same time. Again, to the point of tension, which is about there for this dog, and straight out to about there for this dog. Doing that 15 times, just letting the dog know that they can use their leg. And the same thing here for the stifle and the hip. We can adduct and rotate the knee and the stifle at the same time. And let the dog tell you when when enough is enough or too much. Eventually you can actually get into a situation, and this dog's still sleeping, so you can get into a situation where you can move all joints at once. And you can integrate as much motion as the pup will tolerate. Another thing we should mention before we forget is all medications should be given as per the label instructions. Most pain medications are once a day, and antibiotics are twice a day. And most times you'll be starting the antibiotics the night of the surgery or the next morning, and most times you'll be starting the pain medication the next morning as well. Now, we'll talk about the fentanyl patch.